everyone, and welcome back to Healthy and Kind, a virtual corner of our world where we celebrate all things education and inspiration. My name is Jewel, and I am a health educator with personal experience dealing with chronic Lyme disease. Now, we're going to talk about that quite a lot today, as well as some other theories that go along with the recovery journey. However, before we do so, it is so important that you understand I am not today or any other day attempting, trying, or willing to diagnose or treat any disease, illness, or condition in any one of you. I am here to spread inspiration, education, and a little bit of encouragement so that you are able to navigate your own health journey with confidence. So, as long as we understand that, let's move on with our chat today. And we're going to start at the early ages of my own experience of having Lyme disease. So, when I was 6 years old, I started to notice some really uncomfortable symptoms. They were things like joint pain or bone pain, some dizziness, a little bit of confusion. And every time that my parents would take me to the doctor and they would investigate and examine my condition, I always went home with a clean bill of health. From their point of view, I was just a kid experiencing growing pains, and sometimes being a kid was uncomfortable. However, as I progressed through my childhood, instead of these issues resolving, as the medical professionals thought that it would, things only got worse. My dizziness spells turned into a full-on fainting, and my muscle pain became so intense that after a short walk, say from one classroom to the next at school, my legs would shake uncontrollably underneath the desk. However, even years into experiencing this and years into traveling from one doctor or specialist to the next, I still did not receive any sort of insight or information into why this was happening. So while my peers and fellow students at my schools went on to go to prom or do sports and experience life, graduation, early adulthood, for me, I actually went backwards and landed myself in my bed, unable to care for myself, unable to feed myself, unable to stand up or even lift my head, unable to bathe myself, just like an infant. Now, how is it possible that I could be that ill and have no idea what was going on? We're gonna find out. So, as it turns out, we now know that I had Lyme disease, a bacterial infection that is most often spread through the bites of ticks or other insects. And as is the case with bacterial infections, in theory, Lyme disease should always be treated with antibiotics, right? And we know through years of research that when Lyme disease and the bacteria that causes it encounters antibiotics directly and early on in the infection, the success rate for recovery is extraordinarily high. This means that antibiotics can be effective when treating this illness. However, as we have investigated this condition even further, we have found out that Lyme disease is particularly tricky and able to evade sometimes these antibiotic treatments when the disease has been in the body for so long, right? And so with my illness, not only was I confused and alone without a diagnosis for so many years, but during that time, the percentages, the likelihood of me recovering once I received that diagnosis were going down year by year. And so when we flash forward to when I did finally receive my diagnosis, I was a teenager, my later teenager years, I immediately was placed on an intensive antibiotic protocol. I underwent surgery right away and had a portacatheter placed in my chest, a series of tubes that allowed my family, ultimately, though it may have started with nurses, to pump antibiotics directly into my bloodstream multiple times per day. I was placed on a series of antibiotic oral treatments, and I was on a complicated kind of regimen of a lot of other things. The thought here was that since the infection had become so widespread and so intense, the treatment should match it in intensity. I thought it made sense. I felt hopeful going into this. Unfortunately, years into this intense onslaught of treatment, my symptoms were far worse. And when we think of the fact that I started treatment as somebody who was bedridden and unable to move, far worse is kind of scary. It was seizure activity on the regular. I was experiencing these episodes that are often referred to as a Herxheimer reaction, where my body would seize up, my joints would fold in, so fingers crawling in, head tucking in or bending back, and I would shake uncontrollably for sometimes minutes or hours in excruciating pain. So I have gone through all of this treatment for years, this treatment that we believed at the beginning to be effective, this treatment that we jumped into full force, and now I am worse. And my condition has become so severe. My body has been damaged in such intense ways from both the disease and the really unfortunate side effects of the medical treatment that I was placed on that now, as a 17-year-old girl, I was deemed too ill for recovery. My treatment was permanently halted, and I was offered an excessive amount of morphine and narcotics to numb the pain while we just waited for, you can imagine. This was unacceptable, and you can see now that I have made it to the other side of things. I am healthy, I am here on the internet chatting with you, and to understand what changed, we have to understand a little bit about the theories that healthcare are built upon. Now, what I want you to know right here is that I do have a very sincere love and affection for allopathic medicine, for the Western medical field. I think it is important. I think it is amazing. I am so grateful that there are physicians and medical doctors out there giving it their all. I love it. I think there needs to be more than that. So, the Western medical system is built on something called the germ theory. It is brilliant, it is wonderful, I am so grateful that it exists. The germ theory says that when there is illness in the body, or signs of illness in the body, there is a germ or a problem that is causing them. And that makes sense. Think of strep throat, right? There's this infection that comes in and it causes the illness. And so germ theory says destroy that problem, get rid of the germ, in this case antibiotics with strep throat, and then the body should resolve as a result, right? And so when you think of strep throat, you have all of the symptoms. It's uncomfortable, it's miserable, it's the worst. And then you take the proper antibiotics, the symptoms go away, the infection goes away, you are no longer contagious, and things have resolved. So that's the germ theory. It should never, ever, ever go away. I love it. Again, big fan. However, there needs to be more to the story. When you applied the germ theory to my personal experience, it did not resolve the problem, and in fact, it ended up complicating things further. The side effects of the treatment that I was put on have caused issues in my body that even now, years later, I am still dealing with and working on resolving. And I think there's a long road even from here to go. And so to understand what changed when I, as a teenager, as a young adult, feeling like the world was ending, watching my community grieve me, what we need to understand is that when improvement began happening, my gaze shifted from germ theory to something called terrain theory. Now, terrain theory is this concept that if there is an illness or an issue, if there is a pile of symptoms inside of somebody, there is probably a germ causing it. There's something causing it, right? There's always a cause. However, terrain theory says, let's try, in addition to germ theory, let's try to build up the actual terrain of the body to support the body's systems, to improve the environment that the actual body is in. Let's build up the terrain using any resources that we have and see what happens. I think it's brilliant. I think it is amazing. And so when I was a teenager and facing a very grim prognosis, I was willing to try anything. And so I leaned into this concept of my body is designed to take care of itself, right? When I get a cut, I get a scar, I get a scab, things get better. I leaned into this concept that even if, and not to get dark here, but even if the doctors were right and I was incurable and was going to face my own demise very soon, I deserved the chance to lift my body up so that it had an opportunity. It had an opportunity. And so as a teenager, my family went and gathered old textbooks. These looked like medical textbooks. These looked like nursing handbooks. These looked like even natural health guides and herbalism, and it's so much from local thrift stores, even from nurses and practitioners who were getting rid of old materials. We collected these books. We put them in the bed. We propped my lovely little head up on a water bottle, and we scored these pages for any information that would lead us to potentially creating a better environment for myself. This meant things that supported the nervous system. This meant looking at things regardless of an illness that I had. How could I, as a person with a digestive system, support that digestive system? And I systematically went system by system and tried numerous ways to build up my body's own resources and defenses. And as we now know, oddly enough, we were effective. I made a full recovery. You can see in my blood work when things started to change. And even today, when I look back at old brain scans compared to one that I've gotten in recent years, I am blown away that shifting my perspective and just giving my body a full blown, educated, researched chance and opportunity at recovery worked. My images, as far as the brain scans go, have resolved entirely. I no longer have any detectable bacteria in my bloodstream, which I know is complicated. We'll unpack that in another video. But the thing that I'm saying here is that as we progress through these videos, and as folks like you ask me again and again, what did you do? How did you get better from Lyme disease? It's a complex answer, and it starts with looking towards the good things. I want you to hear me loud and clear when I am not saying come off of medical treatment. I am not saying ignore what your doctors are saying to you. I want you to listen and listen closely. What I am saying is, as you explore all of your options when it comes to recovery or healing or just living a life that feels right to you, I want you to look in multiple directions and always, always invest in the good, the kind, and the healthy. I look forward to learning more with you. Big hugs, big love. I'll talk to you soon.